bringing the most talked about social issues and current affairs.
Taking Thomasian voice with field experts to every angle of the bottom line.
Tigers, it's time to keep our eyes open. Good day, everyone. I'm Seril.
And I am Alzel Laguardia. Join us in this episode of Wake Up Thomasians.
It has been more than 6 months since the world has entered a dark phase in its time. With the global recorded case exceeding 25 million, the world has become more vulnerable to the 2019 coronavirus disease. But up to this day, no vaccine is yet to be discovered.
In the Philippines, COVID-19 cases continue to surge. Flattening the curve has been supplemented by mass testing, where testing kits and processes such as swabbing are used for easy identification if a person is infected by the SARS-CoV-2 antibodies. Health Undersecretary Maria Rosario Vergere expanded that the country needs to prioritize the vulnerable members of the population, such as pregnant women, those who are immunocompromised, and frontline health workers who have the highest exposure to the virus.
Gawaran ay sumasang-ayon na mas marami ang dapat natin matest upang ating magabayan ang ating mga pasyente at maagapan natin ang pagkakasakit at pagkakahawa-hawa ng mas nakakarami.
The Interagency Task Force on Emerging Infectious Diseases issued IATF Resolution number 25 on April 17, directing all government agencies to recommend sector-specific plans, strategies, and targets to the task force.
In line with this, local government units began promulgating programs and projects such as mass testing and isolation facilities that would aid the national government in fighting the pandemic.
Valenzuela City, headed by Mayor Rex Gatchalian, was the first to implement localized mass testing in April. It offered for free to medical frontliners, returning overseas Filipino workers, and residents being monitored for coronavirus symptoms. Also, the Pasig City government had begun testing more than 250 barangay frontliners. Through the aid of Project ARC, or Antibody Rapid Test Kits, Pasig was able to test 10% of residents in the barangay that has the highest ratio of coronavirus cases in the city. The local government, headed by Mayor Vico Soto, also acquired drones to help disinfect the city.
Meanwhile, Manila City government, in collaboration with Project ARC, bared its plans to move to place more areas in the city under lockdown to conduct massive rapid testing among residents and employees in Manila. On July 15, the Manila City government launched the drive-through COVID-19 testing center in front of Andres Bonifacio Monument, where it can cater both Manila and non-Manila City residents.
Meanwhile, Quezon City, one of the cities in Metro Manila that was hit hardest by the outbreak of COVID-19, started its mass testing in April. The city began with the capacity of conducting 1,624 COVID-19 swab tests per week in the 6 district hospitals and the City Health Department's quarantine facility, according to the local government. Moreover, provinces have begun mass testing in their respective regions. As such, Cavite was one of the first provinces to announce its plan to start mass testing. Cavite Governor John Vic Remulla said nearly 2 million people should be tested in the province.
Likewise, the Office of the Presidential Assistant for the Visayas, Department of Health, LGUs, and private sectors started its 10-day strategic rapid mass testing for Cebu, Mandaue, and Lapu-Lapu cities under the Project Balik Buhay, which is a multi-stakeholder plan that aims to balance economic sustainability and public health security of the 3 highly urbanized component cities within an 18-month period. Region 7 LGUs, together with private sectors, launched EBB for responsible re-establishment of the communities, particularly the businesses, in the midst of the pandemic crisis.
Furthermore, the province of Tarlac began its mass testing in April, where the provincial government and the Philippine Red Cross have tied up for the laboratory mass testing of some 1,148 Tarlaqueños.
Well, LGUs have to prepare its citizens to adapt to the new normal while conducting safety protocols such as rapid testings. However, some netizens online were calling the attention of the local and national government to augment the needs for public safety and address the insufficiency of actions seen by the public.
Now, let us know what the Thomasians think about mass testing and its efficiency in addressing the COVID-19 pandemic. This is Am I Right?
Joining us today are students from different programs in the university. We have Mr. J.R. Kamingawan from BS Pharmacy, Mr. Regal Almonte, President of CRS Student Council.
Hi.
We also have Miss Bettina San Pablo from BS Nursing and Miss Margot Beatriz Bucot from BS Pharmacy. Hello, Tigers, and welcome to Wake Up Thomasians. How have you all been? Kumusta kayo?
Okay naman po.
Okay naman
You're
po.
doing great. Yeah.
Okay, kumusta ang quarantine?
Nagko-cope up pa rin with our new normal, but I'm doing good.
Okay.
So let us start with this, our first question, which talks about what things that should have been addressed when this pandemic began. In your perspective, what do you think are the things should be given much more attention when this COVID shambles began? Rigel, your thoughts, please.
I also want to touch on how our healthcare system was really overwhelmed, and I hope that our frontliners earlier on the pandemic started should have been prioritized through providing them with PPEs, through providing them with support that our frontliners needed, especially na sila yung nasa harap sa pag-solve ng pandemic. And it is very important, and sana naramdaman natin that there are ways that the government are doing in order to support our frontliners.
All right, how about you, Bettina?
I wanted to emphasize the travel ban. Kasi if you think about it, if we implemented the ban earlier, we would have had isolated the Philippines, and then we could have had fixed the problem from inside, which would have made it easier for us because it would lessen the risk of increasing the cases.
I just want to ask, given that some local government units have begun conducting mass testing in their respective areas, what do you think about other LGUs naman that are yet to conduct mass testing as of this moment? And do you think they should have it too? No, sa tingin niyo ba kailangan din na yung iba pang LGUs ay magsimula rin ng mass testing? Let's hear it from JR.
Since LGUs are more hands-on in their respective cities that they are governing, I think it would be much easier to contact trace the patients who have undergone the testing na. So, if ever man na positive yung ganitong patient, malalaman na agad kung ano yung mga places na mapupuntahan niya. And it plays a huge role in the transmission of the disease. I think LGU should start na rin, yung other LGU should start with mass testing na rin in their respective cities. Thank you.
Now, we have Miss Margot.
Oh yes, I do believe na dapat umaksyon na talaga ang LGU because the earlier na magkaroon ng mass testing, mas ma-isolate na yung mga positive cases and mas ma-quarantine na yung mga taong nagkaroon ng interaction sa kanila. And nakita naman natin kung ano yung effect nito na naniniwala ko na talagang hindi naman pasaway ang mga Pilipino. Kung nakikita naman natin na if available siya and talagang pinaprioritize siya, willing naman ang mga Filipino to have that testing eh.
Speaking of making mass testing a priority, well, given the resources that we have now, we want to ask you, is it feasible for the Philippines to conduct mass testing nationwide?
I think mass testing is feasible kasi when we say that something is feasible, you can do it and you can maintain and sustain it all throughout. So I think the question kasi na why people are asking if mass testing is feasible. Kasi people have the ideology that mass testing means testing everyone. But then it should be cleared out that when we do mass testing, it is not testing everyone. Hindi naman ibig sabihin na kapag, I'll raise my hand and gusto ko magpa-test, I want to get tested. It's not gonna happen. Kasi when you refer to mass testing, there are only a certain group of people who will be tested, most especially our PUIs, PUMs, our frontliners, and those who are at risk of contracting the COVID-19 disease.
Margot, what's your take?
Yes, it is feasible, but slowly. Kasi kapag nag-conduct tayo ng mass testing, it's not only the kids, but also the one na mag-administer nun. Sobrang dami rin siguro yung need na healthcare professionals na mag-administer nun because hindi lang naman basta-bastang tao ang pwedeng mag-conduct ng mga test na yon. Siyempre, they have to be licensed. And of course, kung ganun, they have to be compensated as well with their salaries, diba? So, hindi siguro siya biglaang mass testing agad. Siguro mag-uunti-unti tayo. We'll start with 10% more today or kung ano man. Basta dapat hindi siya biglaan kasi hindi lang siya parang mass testing yun na kagad eh. Madami pang dapat paghandaan and manpower talaga.
Now, would you consider mass testing ba as our primary COVID-19 response? Or, of course, you have said na kasi na the government should be prioritizing mass testing. What other ways or what other measures do you think should the government be prioritizing for us to eliminate or to mitigate nga ang surge ng ating COVID-19 cases? Let's hear it from JR.
Mass testing should be a priority, but also the frontliners din yung dapat bibigyan natin importance. Isa malaking bagay yun sa dapat din maging priority ng government natin, yung pagiging transparent sa citizens nila.
Now, let's ask Bettina, what do you think?
With the situation right now, ang sabi ko is, topmost priority talaga yung mass testing. Kasi ano pa bang gagawin natin right now? Wala na tayong, naka-travel ban na tayo. Wala naman tayo ibang other, like sobrang kailangan na i-prioritize, kundi yung mass testing. Kasi ang laki na ng cases natin na nag-surge na talaga siya. Madami tayong frontliners and we should prioritize yung mga medical frontliners talaga. Lalo na yung mga nagtitest kasi syempre, kailangan talaga nila yung mga nagtitest and yung mga nag-care for the confirmed patients, kailangan talaga nila ng mga PPEs, ganun. So, kailangan natin ng proper salary din and yung hazard base para justifiable siya.
Tama nga yung reason about prioritizing healthcare workers kasi we've noticed that more and more medical professionals have been lamenting about longer shifts but lower salaries. And we've also seen sa medical professionals, nagkakawahan na rin sila. So, dito papasok yung hirap ng kanilang pagdadaanan sa kanilang pagtatrabaho just to save the lives of those patients, hindi po ba? Right. Thank you very much for sharing your insights, Tigers. We do hope our viewers will be able to get a variety of perspectives and points from what you just have shared with us. Thank you very much and stay safe.
With the Thomasian voice finally heard, it's time to bring the discussion up with the field experts. Joining us today is an infectious disease specialist to share her thoughts about the country's status in fighting COVID-19.
And Dr. Maria Rhona Bergantin is with us now. Thank you so much for joining us and welcome to the show.
Welcome and thank you for inviting me. Hello, Thomasians.
All right. How are you, Doc?
Doing well in the province.
All right.
And trying to adjust to the technology.
All right, Doc. Now, of course, we would like to thank you for sharing your time with us. And we just want to know the very basic question that we believe every Filipino should know. How contagious COVID-19 is and what will happen if the virus enters the body?
Okay, so how contagious it is? Let's say there is one person who is infected with the virus. They say, based on literature, that this one person may infect another person. And at times, the report would say that one person who is infected with COVID can infect 6 other individuals. So this range of infectivity or contagiousness of the virus varies depending on the reports or the authors who made the paper. But basically, ganun siya nakakahawa. Kasi we have what we call as this basic reproduction number, which tells us in infectious diseases, with one person who is exposed, how many individuals can still get the infection coming from that index patient. Now, what happens to the person when the person has inhaled the virus to her body or his body? Okay, so the virus enters into the respiratory tract. It attaches to the receptors and the cells inside the respiratory tract. The virus now sheds off its nuclear particles, okay, and tries to use the machinery of the host. Ito yung machinery ng humans or ng patients in such a way that this virus will now replicate and increase in number. So the virus per se will not be able to increase in number on its own, but it utilizes the human host so that it can replicate and increase in number. And once it has already matured and has completed its replication inside the cell, it will now try to get out of that infected cell. And these number of viral particles, which are now trying to get out of the person's infected cells or dying cells after they get infected, will now be able to potentially infect the other cells inside this individual's body. So, ganun yung basic na nangyayari whenever we have a person who gets to have infection with this COVID virus.
All right.
Yeah, of course, we have heard of what happened in 2003 when the SARS or the severe acute respiratory syndrome outbreak hit. Talk us through the similarities and the differences of that and the novel coronavirus that we have now.
Okay, so similarities, both of them are causes of course, they both cause respiratory infections. So you can have cough, you can have cold, some could have bad pneumonia. Differences, structures, and also phylogenetically, yung mga contents ng viruses. So, yun yung major differences. But then it's quite difficult to compare this to because during the time in 2003 when SARS-CoV-1 was made known to the world, it did not infect much individuals. So, the number who had the infection isn't that much, although they say that it's a lot deadlier compared to your SARS-CoV-2. Again, this is quite difficult to compare because of the lower volume of individuals who have been infected with SARS-CoV-1 compared to the data that we have now with SARS-CoV-2.
Right, and unfortunately, the accuracy of the result is a major concern, no? And speaking of testing, no, sobrang limited po ang test kits po natin, and because of this, only those who needed, in fact, not even a fraction of those who needed it got tested. How does the Philippines adapt to this challenge at this point?
Okay, so what do we do with regards to the testing? So early on in the pandemic, the ones who get to really have testing will be the ones who are critically ill. Okay. Maganda ba siya or hindi? Honestly, if you're going to tell me, I think even those moderately ill or mildly ill individuals really need to be tested at all. Why is this so? Kasi may symptoms ka, dapat ma-identify din natin kung sino talaga si isolate, kung sino yung magkakaroon ng mga protocol para lang hindi talaga makapanghawa ng ibang tao. But unfortunately, that's not done until the time when there has been increase in the number of the testing laboratories. And by the way, when this testing laboratories have been established, there has been a strict WHO protocol that they have to follow kasi with regards to the handling of the specimen, the area where they're going to process the specimen, kailangan susunod yon sa WHO standards. So, mangilan-ngilan lang talaga. And even if we do have these laboratories, the number of or the volume of the patients we get right now who needs to be tested are really overwhelming in such a way that minsan nagbabog down na rin yung PCR machines dito sa mga laboratories na to. I remember that early on in the pandemic, we used to send specimen in one of our reference laboratories, but eventually nagkaroon ng pagkasira si machine nila, and then eventually even the laboratory staff nagkaroon din ng infection, so they have to downsize their capacity. So up until now, mas maganda sana if there will be an increase in the number of quote-unquote accredited laboratories who really follows the standards. And if matetest talaga even those mildly ill, mas maganda. But then, if this cannot be done, for those who really are symptomatic, we follow the isolation na lang na protocol na kung meron kayong sakit, do not report for work. At the same time, stay at home, do not mingle with other individuals in your household, wear mask, wash your hands, maintain social distancing. And then if you're going to cough, cover your cough. Kasi minsan makikita pa rin natin yung mga tao na inuubo na nga, uubuhan ka talaga straight to your face. That's why you won't wonder why is it that even outside, the people are being recommended to wear mask or even face shield. Although kung nasa labas ka talaga and maganda naman yung ventilation, I don't think this is necessary because the virus is diluted and at the same time it's being swept off. Yung hindi lang na highlight siguro sa atin, which is very important, I think, is the proper ventilation. Kasi among the things that are always being put into light will be social distancing, hand washing, wearing of mask. But then ventilation is very, very important. So yung mga nakasarado na bintana, kung pwedeng buksan para mahanginan ang loob ng bahay. Although sasagutin ako, nakatakot sa dengue, nakakatakot kasi maaalikabukan. Yung alikabok, pwede po natin malinis yan. Pero at least, yung mahanginan man lang, ma-aerate yung loob ng bahay, it's very important din.
All right. Ma'am, now you've mentioned, Doc, no, na it would be best if we will have more testing kits or testing centers, no? But now, do you
Yes.
think our country is capable of increasing its testing capacity at least twice or thrice as the Philippines does today?
Probably yes. Probably if we're just going to allocate the budget where it's really necessary, we can do that nasa lang naman yan nasa proper budgeting lang naman sa allocation siguro ng resources. We have to check on the hotspots here in the Philippines, and then in those areas where there is hotspots, there is where we should focus our testing. Kasi di ba meron kasi yung mga epidemiologic maps na lumalabas. Saan bang lugar sa isang bayan yung mas maraming lumalabas na mga may sakit? Kasi kung makikita mo at makikita kung let's say by map, by epidemiologic map, sila yung mapula talaga. Ibig sabihin, mas yung density nun, mas maraming tao na infected per number of population, sila yung ifo-focus mo, sila yung pwede mong i-test, and at the same time, sila rin yung quote-unquote, malalagyan mo talaga ng quarantine talaga. Kasi what we do right now is, di ba, pocket quarantine or yung specific areas lang. Mas maganda sana to para nababalance din natin kung ano yung mga kailangan.
Right, we've been discussing mass testing all throughout the show, and as we have observed, many of us are really holding on to that because we want to know exactly how many people have been infected with the virus. In your perspective as a medical frontliner, talk us through the significance of mass testing to citizens.
Okay, mass testing, that's only for epidemiologic purposes, but then for clinically, it's not applicable. Basically, our health capacity or our health institutions here in the Philippines really cannot accommodate all these individuals who would manifest even with mild symptoms or let's say onting sniffles lang or onting ubo. We really do not advocate mass testing. Again, this is for quote-unquote epidemiologic surveillance only. We go first with those individuals who would have symptoms. So symptomatic testing tayo para malaman natin kung sino talaga yung meron at hindi. Why is this so? Again, for proper allocation of our resources. And at the same time, when we do mass testing, magpapanik lahat ng tao. As it is, nagkakaroon na ng kaguluhan, ako yung mauuna, ito muna, etc., nababump off yung ganyan. So, I don't think it's prudent to do this. Given the limited resources of the Philippines and limited laboratories that we have, then we test kung sino yung nangangailangan. We isolate them, and then if proven that they are really not infected with SARS-CoV, then we can allow them to mingle with society. The problem that we have here now kasi with regards to this illness, okay, going back to the pneumonia that we have in the past and the pneumonia with regards to this SARS-CoV, para lang malinaw, nung unang panahon kasi pre-COVID, whenever we have a patient who would have pneumonia and then these patients have been treated in the hospital and then we send them home to their specific houses, no question about that, kukunin sila ng family nila, aalagaan sila ng family. But this time kasi, since your COVID is a public health concern, bago kami magpauwi ng pasyente coming from the hospital, bukod sa kamag-anak, kailangan namin i-inform yung local government unit. Recovered na ba to or kakailanganin pa nila ng quarantine? Kasi kung hindi pa sila recovered, minsan hindi sila tinatanggap ng community na sa bahay lang titigil. Pinadadala sila sa quarantine facilities where they are supposed to quote-unquote complete their quarantine. So, hindi siya ganun kadali. So, usually 5 days bago ma-discharge si pasyente, yung mga nurses natin nakikipag-coordinate na doon sa local government unit. Ano po ba yung requirements ninyo para maibalik po natin itong mga pasyente na ito sa kanilang pamilya? Kasi we have to comply with the requirements of these local government units. At times, it's quite sad that even family members of these individuals who are sick wouldn't want to have these recovering or recovered patients back in their household. Kasi natatakot pa rin sila na baka mahawa at mahawa. So, ito yung mga nakikita natin karaniwan na differences with regards to patients who have been ill with pneumonia before, with common bacteria, with common viruses, and the difference that we get to see whenever we handle patients who would have COVID.
Right. Now, Doc, I just have a quick question. No? Since we are yet to have a vaccine, do you have any, and of course, we have limited testing centers, and as what the DOH said, no, talagang na-overwhelm na ang health system natin dito sa ating bansa. Do you have any tips or alternatives for people who have symptoms or may mga sintomas silang nararamdaman? Do you have any tips po or remedy na pwede nilang gawin?
Remedy in terms of, let's say, iinumin or kakainin, something like that. Okay. Basically, wala. Wala talaga siyang iinumin. But what we often give is that, what we often say is that whenever you have symptoms, and this has something to do with, let's say, like flu or sabihin na natin na COVID, you just stay home, rest, drink plenty of fluids, eat nutritious food. Yun yung pinaka-importante na ibibigay at ibibigay. Some studies would recommend the use of megadoses of vitamin C or zinc as well. I don't think there is anything wrong with that. But basically, if there will be progression of the symptoms, then dun siya kakailanganin talaga na kumonsulta sa health facilities, because that is what the DOH has really been recommending even at the start of this pandemic. For those individuals who are mildly ill and who can be observed at home, then home observation is what you do. Allow them to drink plenty of fluids, so juice, water. Walang specific na recommendation whether you want to drink, let's say, fresh fruit juices or let's say canned fruit juices. Wala siyang specific recommendations. And then for those individuals who have been harping about the use of, let's say, commercially available medicines for prophylaxis, wala po siyang proven benefit pa, ha? So anything that may put us into harm, we should not be taking these things. So at this point, whenever we talk of viral infection, the infection often is self-limited. So if the immune system is really quite good at addressing the infection, allow the immune system to work. At times, patience is a virtue. Actually, not necessarily at times. Always, patience is a virtue. So, hihintayin lang natin kung ano talaga yung natural course of illness. Now, while this individual is ill or these individuals are ill, definitely you don't want to infect others. So, that's why staying at home, always follow pa rin yung sinasabi sa atin na distancing, proper wearing of mask, hand washing. So yun yung mga kailangan natin na sundin.
All right. Thank you very much, Doc, for sharing those remedies and alternatives. And of course, thank you for sharing your time with us. And of course, we hope that our viewers would be able to get very important information from what you just gave us. All right.
Okay, you are most welcome.
And that wraps up today's episode. Above all, remember to keep yourself safe from the virus by practicing physical distancing, wearing face masks, and sanitizing. Together, we can fight this pandemic.
We are hoping you've learned important information that'll aid you fight not just COVID-19, but the proliferation of misinformation in crucial times like this. Thomasians, it's time to keep our eyes open.
Once again, I am Seril.
And I am Alzel Laguardia.
Join us again on the next episode of Wake Up Thomasians.